Now we're ready to study the arteries of the abdominal region. So again, we're going to start at the aorta, or the aortic arch rather, which then descends through the thoracic cavity as the thoracic aorta. It passes through the diaphragm into the abdominal region where it becomes the abdominal aorta. And then there are several arteries that extend from the abdominal aorta that you're responsible for knowing. We're following the aorta as it passes through the diaphragm into the abdominal cavity and becomes the abdominal aorta. There are several arteries that are going to branch from the abdominal aorta that you're responsible for knowing. First, coming off of the abdominal aorta is the celiac trunk. Now, you've already learned of the brachiocephalic trunk as well as the pulmonary trunk, but I've never actually defined what a trunk is. A trunk is nothing more than a short artery. It's an artery that almost immediately branches. And if you look at the celiac trunk here, it's very short. It immediately branches into three arteries of interest. One is the left gastric artery, which is supplying blood to the stomach. Gastro means stomach. This is the common hepatic artery. The common hepatic artery supplies blood to the liver. Hepato means liver. If you have hepatitis, you have inflammation of the liver. And lastly, we have the splenic artery. The splenic artery supplies blood to the spleen. The wonderful thing about these arteries is they're named after the visceral organs to which they supply blood. If I ask for any of these arteries, the splenic, the left gastric, or the common hepatic artery, I will always have the visceral organs present. I'll never have an image where it's just the naked blood vessel. If I ask for the left gastric artery, I'll always have the stomach there, or the same for the splenic or the common hepatic artery. Also, you do have to include left with the left gastric artery because it is not symmetrical with the right gastric artery. Let's look at some additional arteries of the abdominal region that you must know. This is the renal artery. It supplies the kidney. Renal refers to kidney, thus its name. And again, I'll always have the kidneys present if I'm asking for you to identify the renal artery. There are, however, three arteries I could ask you to identify without the viscera, and more than likely I will ask you to identify them without the viscera because the viscera actually makes it a little more complicated and difficult to identify, as I'll show you in a moment. This is the celiac trunk. That's that same celiac trunk you saw a minute ago. Here the left gastric, common hepatic, and splenic arteries have been removed, and I could ask you to identify that celiac trunk without the viscera. Inferior to that is the superior mesenteric artery. Mesentery refers to the intestines. The superior mesenteric artery supplies blood to the small intestine and the proximal portion of the large intestine. Moving inferiorly, we have the inferior mesenteric artery. The inferior mesenteric artery supplies blood to the distal portion of the large intestine. This is an image of the mesenteric arteries, and you can see why I will not include the viscera when asking for those arteries. But here's the superior mesenteric artery here, and here is the inferior mesenteric artery here, supplying blood to the distal large intestine. Before we leave the abdominal region, I do want to point out the gonadal arteries, which supply blood to the gonads. If you know that you are looking at a male subject, you can refer to them as testicular arteries, and for females, ovarian arteries. But for the purposes of this lab, I am fine with gonadal artery. And finally, we've come to the arteries of the lower limbs. So we're going to follow that abdominal aorta as it extends into the pelvic region. There it splits into two common iliac arteries. The iliac artery, of course, is named for the iliac region, and we see the term common in its name, meaning that it's going to divide, and the two new divisions are going to retain that name. And indeed, that's what happens as we have the internal iliac artery here and the external iliac artery here. Now we're going to follow the external iliac artery as it passes into the thigh. There's a branch and it becomes the femoral artery. The femoral artery then continues to extend distally. Then there's a branch, and as it passes through the posterior knee, it becomes the popliteal artery. Now we're going to switch to this other image to the right here because it just shows a better image of the arteries of the leg. As that popliteal artery extends into the leg, it divides into an anterior tibial artery and a posterior tibial artery, both named for the nearby tibia bone.